And we are live. Welcome, everyone, to the Melanin Initiative. I'm Dr. Kimberly Madison, a doctorally prepared nurse practitioner and one of your co hosts for the Melanin Initiative podcast. In healthcare, there is often too much information and not enough time. Here at the Melanin Initiative, we avoid TMI. By breaking things down into language you can understand, we create a safe space for you to ask your questions, and we share a nursing perspective. All month long, we'll be talking about breast cancer. Each of our guests will be sharing their relationship with breast cancer. So it'll be slightly different from our regular episodes, but we think you're going to find a lot of value in them. We're so grateful for everyone who has agreed to share their story. It's been a long time. Our season 1 ended at the end of July. And so this is our first time coming back. Season 2 officially kicks off in November, but breast cancer is very special to me. And so we couldn't let the month go by without doing some episodes specifically dedicated to it. So often people think they're the only ones going through something, and that leads them to suffering and silence. We know and hope through this show you'll see that you're not alone, and there are a number of resources available to help you. We hope you'll be motivated to do what you can when it comes to your health, to establish a relationship with your primary care provider who can identify your risk factors and tell you all about the available options. But most importantly, we hope you'll understand the importance of early detection, which I cannot emphasize enough. The data shows that when it comes to Black and Brown communities, we wait too late to be diagnosed. And once we are diagnosed, the disease is so advanced that the options for treatment are limited, and the risk of death and disability is that much higher. Knowledge is power, and so is having a support system and understanding the importance of advocacy. My goal is to address each of these themes throughout October. We'll be releasing a new episode every Tuesday in October for TMI Tuesdays at 10. You can find us on all your favorite podcast apps, including Apple and Spotify, as well as YouTube. Today, I'm so happy and excited. I'm joined by Lori Lee. We're going to be best friends after this episode. She's going to help us kick off our breast cancer series. But before we jump into our questions, we just want to remind you that this show is for educational purposes only. The opinions are our opinions alone. They are not a representation of any of our affiliations. If you're experiencing a medical emergency, you should seek medical attention and medical guidance from your healthcare provider. If you're having a physical emergency, you can call 911. And if you're having a mental health emergency, you can call 988. Lori, welcome to TMI.
Hi, thanks for having me. Thanks for having
Thank
me.
you.
You're welcome.
Help us get to know you. Tell us a little bit about you, your family, where you're from, and what you do in your free time.
Okay, well, I'm Lori Lee. I'm a native of Jacksonville, Florida. I'm born and raised. Went to school here. Um, I'm the oldest of two. My sister, her name is Paris Lee. She resides in Nashville, Tennessee. So, as pertaining to breast cancer, my mother, she passed away from metastatic breast cancer in 2018. She was first diagnosed with stage 2 in March of 2014. She was cured from it. She went through her radiation treatments, chemo treatments, and was cured for in 2016. And the cancer returned. So it
So
returned into
Lori,
huh?
before you get too far ahead,
I can,
before you get too far ahead, one of the things we do here on this show is we promote health literacy. And so
right.
a lot of times what I believe is that a lot of reasons people may not do the things that we're recommending or do struggle with healthcare is because they simply just don't understand, right? We don't get classes on this when it
Right.
comes to like high school or college. And so one thing we like to do is just kind of take our time in explaining the topics. And so before you jump
Okay.
into your mom's diagnosis,
Okay.
just tell us a little bit about her and what was going on at that year that she was before she got diagnosed.
Well, that year she was diagnosed with diabetes, and then a year later, well, not a year later, but a few months later, she was diagnosed with stage 2. She found that there was a lump and there was some leakage coming from her breast, and so
Okay,
she
how old was she at that time?
At that time, she was, I want to say about 48, 49. It was
Oh, yeah.
before she was 50. Um, they told
And was
her,
there a history of breast cancer in the family?
no, she went to the doctor and they said it was environmental. So, she did do the hereditary testing, and they told her it was environmental. But we did find out at her passing that her oldest sister had breast cancer and lung cancer as well. So
And is she from Florida as well?
yes, my mother, yes, she was from Florida. My dad, he's also from Jacksonville, Florida. So he was her support system, you know.
Mm.
You know.
So before she got diagnosed, was she still working full time?
No, she wasn't working full time. She was, well, technically she was. She was helping my dad with his business. He had, self-employed. His employment is plastering stucco. So she was in business with him, helping with that.
And what was her health like? Did she work out? Did she kind of watch what she ate?
Yes, she did. She did watch what she ate. She did work out when she could. We try to eat healthy, incorporate healthy eating, but sometimes we like to pull in the fast food restaurants, kind of frequently because we was still in high school. Me and my sister, early college, and my sister was in high school. So, yeah, so we try to eat healthy as best as we could.
And so how would you have rated her health prior to that? Good, fair, poor?
I believe it was good. I think like once she got older, the weight gain come along as we get older. Um, all the health related issues start to come on as well. Like I mentioned, she had diabetes. She developed diabetes and high blood pressure. Once she got older in her late 40s.
Okay, so you said that it's first started off with the diagnosis of diabetes, and
Mm-hmm.
and you were in high school at the time?
I want to say late my late 20s, early 30s. She was like 40, 48, 49. I would say.
Okay,
Yeah.
and was she communicating this with you? Was she pretty open? Were both your parents pretty open about their
Yes,
health status?
yes. She did communicate with me and my sister. What this was happening to her. I know she said when she was first diagnosed, she had blurred vision and she couldn't understand why. So that prompted her to go to the emergency room, and they said her blood pressure was off the charts. So they, at that time they diagnosed her with diabetes, and then she had to take all the insulin shots and all that. That was just hard, seeing her do that, inject herself with insulin on a daily basis.
Yeah, and did was she having, besides the vision, that's what drove her to go to the doctor?
Yeah, the blurred
And was
vision.
it primary care? Do you know if she went to primary care?
No, she didn't. She went to the emergency room. Um,
Oh, I see. Okay.
yeah, she went to the
And
emergency
then
room.
that's where she got her diagnosis. And then how soon after that did she go, or I guess how did she end up finding out she had breast cancer? Was she having symptoms?
Well, she went to her OBGYN doctor here in Jacksonville, and from what my dad was telling me, she noticed that there was kind of a lump, and she did the self examination, and she went to her OBGYN, and you know how they go through with that, and she was diagnosed with stage 2. Maybe a few months after her diagnosis with the diabetes. I went to her doctor appointment at that time when she went to her OBGYN, but I did not know why she was going. So, yeah. Yeah.
And which, besides feeling the lump, like with her hand? Did she actually have pain?
No, no, not to my knowledge. It was just a lump in her, in her breast that she felt, and like the discharge coming from her nipple, her breast. That she That's the only symptom that I knew of that she had.
Okay, so yeah, you can go ahead and tell this story on like her treatment and how that went, any changes that she went through.
Yeah, so she was diagnosed the first stage 2 in 2014. She went through chemo treatment. She lost her hair because she had a head full of hair. So she lost her hair, her nervous system, the feeling of her fingers and her toes. She really couldn't feel them because me and her used to have girl time, and I would paint her toenails, give her a pedicure, and I was trying to paint her toenails, and she couldn't feel it. She couldn't feel my touch. So I noticed that was something going on there. She, through 2014, the end of 2014, up until I want to say about June of 2015, she went through all her chemo, and all the cancer was removed. And then I want to say about September, October of that same year, she went through radiation treatment. So the whole year of 2016, she was good. She was living life to the fullest. She loved serving in ministry alongside with my dad. She loved singing. She loved cooking. So all of that, she was just living life to the fullest until it returned in 2017. I want to say it was April of 2017 after our pastor passed away. Or well, he was diagnosed with cancer as well. So I want to say April 2017, the cancer returned, and it was in an aggressive form, stage 4, metastatic breast cancer.
And what symptoms was she having that prompted her to go seek care at that time? Do you know?
Um, well, she did her routine checkups. The cancer was cured. She did her routine checkups, and they put like a port inside of her body, and some type of tubing to drain the fluid, whatever that was going on there. So she went back to her doctor in April of 2017, and they said the cancer returned in an aggressive form. Yeah.
And was she having pain or feeling weakness,
Oh
change in
yeah,
appetite or weight?
she was in pain. She was actually my size, actually, and to see the drastic weight loss, she lost a whole lot of weight. She really couldn't, with the medication that they prescribed her, she couldn't keep anything down. As far as food, she wanted to eat, soul food, the good, delicious food, but she really couldn't. She couldn't keep it down. So I thought maybe it was the medication, but actually it was the cancer that returned, and she just couldn't keep anything down. So she lost a lot of weight. She was really, really thin when she passed, really, really thin, and it was scary, seeing that from my size to skin and bones.
Oh, yes, I'm so sorry that your mother had all of you had to go through this. Were
Yeah.
you local at the time? Were you able to go to any of her appointments?
I was local at the time, but no, I wasn't able to go to any of our appointments. I would say the latter part of 2017, around Thanksgiving, Christmas time, she developed pneumonia, walking pneumonia, and flu. So we all took a trip to Nashville, and we was all up there, and she contracted the flu and pneumonia, and then she was released from the hospital, and then got went back to the hospital the ending of December. So yeah, just thinking about it, it just brings floods so many emotions.
Yes, we can definitely understand that. When she got diagnosed with the metastatic breast cancer, did they recommend chemo and radiation again or surgery?
I want to say they recommended her with the chemo again, and when she had a pneumonia, it kind of spread it through her lungs and everything like that. So they was trying to recommend her for chemo. I don't think she wanted to go through that again. So they was prescribing different types of medicine. When she went back into the hospital, they had to sedate her because she was in and out um, December, January, and February. So they had to heavily sedate her and to try to get the cancer, try to do the best they can to they say keep her comfortable. So yeah. So at that
And did
time,
she spend all that time? Oh, go ahead. No, go ahead.
no, at that time the cancer um it moved throughout her body, so they did the best they could.
And did she spend all this time in the hospital? Did they recommend hospice care at any point?
They did. I want to say February 2018, the early part of February 2018. That's when they sedated her, and she didn't come out of that. So they did suggest hospice. They did say, "Oh well, we're gonna do what's best to keep her comfortable, during that time." But we're a family of faith. We believe God can turn the situation around. We've seen miracles happen before, even through her first round of cancer. We still believe that God is a healer. You know, and at that time we believed that she would pull through. But she couldn't. The cancer spread it from her lungs to her liver and ultimately to her brain.
And what was it like as the daughter seeing your mom go through this? What kind of questions did you have for her or her doctors?
Well, my mom, she wasn't speaking, so I couldn't really ask her anything. At,
Well, before it got that far, like when the first diagnosis and then when it came back and she was still, able to talk and participate in her care.
um, what she told me and my sister, we even though we were young, she said, "Hey, y'all need to, do early detection," because she was aware of her oldest sister having breast cancer and lung cancer, and they told her doctors told her it was environmental, but she highly suggests me and my sister both to go ahead and do early detection. Early detection is key. So and I would ask her, I said, well, how did you feel going through the whole thing? And she said, I don't wish this on anyone. It seemed like they put poison inside my body as far as the chemo. I will always hear her say that. And I know I mentioned that she loved to cook. She wasn't able to do any of that, anymore.
And for you at this time, you and your sister, were you two talking about it? Were you each other's support system, or did you
Um,
need to find support outside of your family?
Most definitely. My sister, we were both supportive during that time. And then also our church family, they was there. That every week they was at the hospital, praying for her, interceding for us because, it was scary to see mom, in the hospital with tubes coming out of, everywhere. So yeah, so the other than my family and the church family, they were my support system and her support system as well.
And did she have any, like a living will or advanced care directive, any documents with her wishes?
No, other than whatever she told my dad, whatever they had set in plan. But no, because she was expecting to come out of it. She was expecting to, fight it, beat it.
And so since that passing, what has your life been like?
My life has been different without her. I always hear her voice. I, I still go through grief, the whole grief process. I know I'm better now than when I was years previous. I know it will be 7 years in March, but life has been, I can't say great, but I know she's looking down and cheering us on from heaven, from the balconies of heaven. I I started my business in honor of her and her memory. I found my purpose. I found my purpose since her passing. With support groups, I attend a local, well, it's a national support group called Grief Share, and they helped me work through my grief. Because my grief was in waves. So they did help me through that. So life has been bittersweet, without her.
And you mentioned that you did get some genetic testing done. Or do you want to share those results?
Oh, well, I didn't get any genetic testing done, but she did. My mom, she did, and they told
Okay,
her,
you said she had told your sister to do early detection. Was that just an exam?
yes, the exam. Yeah.
Okay, and that's the breast exam or including a mammogram?
Well, the breast exam, I've had the breast exam and I had a mammogram screening of last year. They with my mammogram screening, they found an abnormal, something abnormal in my right breast, and I had to go back and do a follow up diagnostic imaging and supplemental ultrasound.
And your sister, did she also go ahead and get examined and
We
get
have
a
not
mammogram?
yet. She have not yet. Yeah,
Okay.
she's younger. She's younger than me, but I highly recommend that she go ahead and get it done.
And before you tell us a little bit about your business, you mentioned that your mom was less than 50 years old at the time of her first diagnosis.
Right.
And I found it interesting. You said the doctor said it was environmental.
Mm.
And yes, there are definitely a number of causes for all kinds of cancer. But typically, when we see people less than 50, there's a increased concern for a genetic component. And
Right.
so we typically will recommend for women and men to go and get screened. That includes the breast exam as well as the mammogram. And then because she was so young and she did develop metastatic breast cancer, genetic screening would be top of the list for that. So the
Right.
recommendations for breast cancer, they have changed over the years. So people may be a little bit confused because
Mhm.
people look at research and they base the recommendation off the research. And so the American Cancer Institute, American Cancer Society does still recommend women to get their mammogram at the age of 40. And of course, you can have this conversation with your provider, and that conversation is going to include your risk factors, with a high one being
Mhm.
having a first degree relative like a mom, like you
Right.
and me. Even my mom, one reason that we're even doing this special is because of my relationship with breast cancer, because my mom was diagnosed with breast cancer, and she'll be on as well to share her story. And so I did so actually, I got my first mammogram much younger than 40 because of that and because of the
Mhm.
relationship with my primary care provider. And so I've been getting them much earlier than was recommended because of that, even though she was older than 50. And so the chances of it being
Mhm.
genetic are much lower. But I did all of that, the breast exam, mammograms, and the genetic screening, just so that to let our audience
Yeah.
know what the options are, particularly if you are the daughter of someone who has been diagnosed with breast cancer. And again, we want to make sure that we include men in this conversation because men can still get breast cancer.
Exactly. Exactly.
So tell us about your business.
So my business is Trisha's Precious Gems. My mother name, her name is Patricia Lee. The family nicknamed her Trisha for short. So Trisha's Precious Gems, we specialize in custom handmade gifts and keepsakes. I do mugs, pins, apparel, home decor, whatever a customer wants. I will try my best to do. So I've been in business for 4 years this past July, and it has evolved. I started out with the beaded pins, and then now it's mugs and home decor, Christmas wreaths, door wreaths, drinkware, T-shirts, all the above. So yeah, so I'm doing it in honor of her. You know, yeah.
Oh, wonderful. I'm sure she's so proud of you. And this is a perfect time to share your pictures that you sent me. And I'm going to put these on the screen. Can you see those?
Yes.
And just go ahead and tell us what we're looking at.
So this was back in March of this year. The Susan G. Komen, we went to the state capitol in Tallahassee, and I met with Miss Marie Woodson. She's representative of, I believe, Orlando.
And what is Susan G. Komen?
Susan G. Komen is a breast cancer organization promoting breast awareness education. They do walks, races. They do, different various of things. I'm a part of the Susan G. Komen Center of Public Policy Ambassador Program, where we go to the state capitol and to Capitol Hill, advocating for breast cancer patients.
And how do you describe advocacy to other people?
Advocacy for me is being the voice to the voiceless. That's what advocacy means for me and how I would describe it. So pretty much those who don't have the courage to speak out, or who does not have the means to go to these various places like the Senate floors, or speak to congressional leaders. We're doing it on behalf of the voiceless, and those who are, in memory, like I am for my mom. So.
We're so grateful for your work and all the other advocates. We dedicated a show to advocacy during our first season, and we still received a lot of questions about how to find an advocate. So what do you tell other men and women or even family members who are looking for an advocate? Where should they start?
I suggest look up, Susan G. Komen, and they can find one within the local area. I even have family because after we had our virtual summits and our in-person summits in Washington, I have family members message me saying, "Hey, something going on with my breast. What do you suggest for me to do?" And I said, "Okay." So I did the best I could. I sent them links for the state and Susan G. Komen. And my friend, her aunt was recently diagnosed with metastatic breast cancer. And she's like, "Hey, Lori, can you just pray for me? Do you have any suggestions?" Because she lives in Oklahoma. And I Googled different organizations in Oklahoma that she can possibly reach out to.
Oh, that's so wonderful how you're using your journey to help other people. And thank you for giving us some actionable steps.
Yeah.
Okay, what are we looking at now?
So we're in Washington. This was in June, the Advocacy Summit in June. So we're with Representative Darren Soto. He's a state representative here in Florida, Central Florida.
Wonderful. And here?
This was back in June, before, maybe a week exactly before the summit. We had a community event here in Jacksonville, the Purpose Conference. And this is my setup, my display. So I have a few of my mugs here, and the center table actually provides reading material for breast cancer, um, educational material from Susan G. Komen, as well as the American Cancer Society. So I'm pretty much adding breast cancer awareness to my business, if that makes sense. Yeah. And this is my sister Paris. This was her first summit, so she was really excited. She was really excited about that. Paris, she's actually the secretary of the Nashville chapter NAACP. So this gave her experience going into speaking with different congressional leaders on Capitol Hill.
Shout out to Paris. She's welcome on this show at any time.
Okay, okay, I will. And that's my mom. That's my mama. So this was one of the last pictures, September of 2017. She lost all the weight, but this is actually one of my favorite pictures of her that I took. This was after church service, and we were just sitting around, and I just snapped out one of her. And if you find, if you go on my website, that picture is on there. Yeah, so yeah, that's my
Well,
mom.
she's
And
beautiful.
thank you.
Thank you.
And she was 53 when she passed. 53 years
Oh,
old. Yeah.
very young, yeah. And this is your logo?
Yes, that's my logo with the
And we'll
butterfly.
put all your
Pardon
Oh, go
me.
ahead.
With the butterfly, me and my mom, we both love butterflies. She said when she was younger, she would draw and paint butterflies, and I love butterflies as well, as much as she did. And every time I see one pass by, and I was like, "Oh, there's a butterfly," Mom must be thinking of me. I don't know. I don't know. Something, it was a common shared mind. One of the common shared minds that me and my mom had, the love for butterflies.
And how can people connect with you?
Well, they can connect with me. I'm on Instagram and Facebook, Lori Lee. My business, Treasures Precious Gems, is on Facebook, Instagram, TikTok, YouTube now. I'm on LinkedIn as well. I'm on LinkedIn as well. You could both find, my name, Lori Lee, or Treasures Precious Gems on both all social media platforms.
And we'll put all your information in our description box and show notes so people can have it there as well.
Okay.
Before I do my closing, anything else you want to share with the audience?
I want to say thank you for having me. And I want to say early detection is key. You cannot go wrong. I know it may be scary because I went through it this time last year. I went through it, and doing the mammogram screening, and then coming back and said they found something. I would say go ahead and get early detection. I was clear. I was in the clear after doing the diagnostic imaging and ultrasound, but the earlier, the sooner, the better.
Thank you so, 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 so much.
You're welcome.
So today, everyone, just to recap, we talked about Lori's relationship with breast cancer, which was related to her mother, who was diagnosed with stage 2 breast cancer before the age of 50, and then unfortunately died from metastatic breast cancer a few years after that. She had a beautiful life filled with lots of love and lots of faith. Lori was kind enough to share the role that faith played in her family and her mom's journey. She emphasized the importance of early detection, including genetic screening, which we can't emphasize enough. And we'll continue to talk about those throughout October. And of course, she mentioned the benefits of being part of a support system. She turned her grief into into Advocacy, which is the power to speak for those who can't speak for themselves. And now her testimony is inspiring not only her family, but everyone else that she comes in contact with. She took her ability to use her voice as far as to the Capitol. We know that the only way to make true change, sustainable change, is through policy. And it's so great to see her and her sister in this fight together for our community. Remember, we'll be releasing a show dedicated to breast cancer every Tuesday in October for a total of 5 episodes. Season 2 officially starts in November, where I'll be joined again by my co-hosts, Alicia and Geraldine. We have a great lineup of topics for you. We're so excited to welcome back Kelsey, our favorite trauma therapist. If you haven't already, check out our episode with her. It was our Juneteenth special on intergenerational trauma. It's one of our most popular shows, along with nurse Alyssa, who shared her journey as a nurse with sickle cell who cares for kids with sickle cell. And then, of course, our diabetes episode with Dr. Mark Smith, a Black pharmacist from Alabama who is also a diabetes educator. And, you know, if you remember, Lori shared that her mom's kind of beginning of this journey started with that diagnosis of diabetes, which is playing a huge role in our community as well. You can email us your questions or show ideas at tmi.melanin@gmail.com. Subscribe to our YouTube channel and follow us on Instagram, TikTok, and Facebook. Please share our show with your friends. Rate us on Apple Podcasts, Spotify, whatever platform you're listening, and leave a comment. It really helps the show grow and get more support, and it gets the message out there to those who need it. You can find our social media links and any resources that we've discussed in this show in the description box. We'll see you this Tuesday on TMI Tuesday at 10 a.m. to kick off this breast cancer series. Follow, like, share with all your friends. Lori, once again, we thank you so much for taking some time out of your day, but most importantly, to share the heartfelt story of your mom. I know it is not easy, and we do not take that for granted. We have faith here, and we know that your story is going to impact someone and motivate them, and also inspire them and remind them that they do not have to suffer in silence. There is help out there for them. One of the reasons we do this show is because there is a lack of trust in the community when it comes to healthcare. And part of that is representation, seeing other people who look like you and me, and just hearing that story, that there's people that look like you fighting for them every day on the Capitol makes a difference. It really makes a difference, and it speaks very loudly. And we thank you for your sacrifice, your dedication, and your heart.
Thank you. Thank you for having me.
Our pleasure. Thank you for watching, everyone. See you next time.